Hi, I'm Dr. Rindy, and this is the One Thing podcast. Thank you for joining us live on this Facebook and YouTube live feed. I'm here with Dr. Laura Brown, and I will introduce her first. She's been so gracious to join us today. Let me just give you a little bit of background on Dr. Brown. Dr. Laura M. Brown is a registered naturopathic doctor with a functional medicine approach. She focuses on stimulating the body's natural mechanisms to repair damage and rebuild health. She is a heart math certified practitioner, a level 2 certified gluten-free practitioner, and holds the designation of ADAPT trained practitioner from the Kresser Institute, the only functional medicine and ancestral health training company. Titled Miss Teen Ontario at age 16, Dr. Brown battled many health challenges on her own, ultimately prevailing through naturopathic medicine. Personally, she writes, gardens, hikes, and entertains on 20 beautiful acres in the heart of Ontario, Canada. You can learn more about her by going to southendguelph.ca. That's southendguelph.ca. Dr. Brown, welcome to the One Thing podcast.
Thank you so much, Dr. Rindy. I really appreciate it. It's great to be here today.
Yeah, it's great to have you. So first of all, I just wanted to say congratulations on your new book. How's it feel to complete a book and have it actually in your hands?
Yeah, it feels pretty awesome, actually. Yeah, pretty good.
When did you start writing? When did the project start?
September 2019. So really great timing ahead of the whole COVID thing, because as we were all in our homes more with less interaction, it actually was pretty advantageous to be writing.
Yeah, absolutely. Yeah, there's all these amazing stories that have come out of this period of time of people being able to finally do some things that they never really had the time to do, or didn't have the right setting to accomplish, various projects.
Yeah, creativity is awesome.
Yes. So, well, it's always great to be talking to someone who also focuses on gut health. And I feel like we often are kind of a group of people who have similar ways of practice or similar ways of viewing health. What's driven you to digestive health and gut health?
Essentially my own gut, because it hasn't been too friendly, but lots of issues with my own digestion through the years, and trying to, piece that apart and figure it out. When I had competed in some fitness competitions when I was younger, I really learned how food affects the body, and in some interesting ways, not all good, but learned a lot from it. But I always wondered when I was preparing why I had such mental clarity and felt so much better. And it took me a while to figure out that gluten was a part of that. And um, it wasn't something that came right away. It was in my 30s when I realized that that was an issue for me. But as I pieced the pieces of the puzzle together, hindsight is wonderful. And with that, of course, as you know, in practice, you often attract people into your practice that have similar issues that you do, even when you might not know it. And
Yeah.
they often teach us. And I mean, that's a lot of the patient stories that I share in my book, because my patients have taught me so much. And often to look at things that are lurking in my own shadows that I'm not aware of. And it's like, oh, never thought of that. Let's see. And, as a naturopath, we're often eager to go down the paths for other people and not worry too much about ourselves. But here I do the path together, and really prevailing through, naturopathic medicine, the ability to do the testing on the food sensitivities, the ability to look at what is in our microbiome to see what's not quite right.
Hmm.
Um, so yeah, it's really part of my path, and the learning never ends. Yeah.
Excellent. Yeah, it's definitely gives you a good feel for when the heart of a condition is digestively oriented, right? When you've gone through some of those challenges yourself.
It does, and I find people come into clinic, and those cases that just aren't getting solved, and people have been to multiple doctors and they can't figure out what's going on. And sometimes I'll be thinking really hard and trying to figure out what it'd be, and I'll be going down all these different paths, and then I'll sleep on it, and wake up and it'd be like, what about the gut? What's going on in the gut? And more often than not, it's what's going on in the gut. And then we come back to it and addressing it, you know, things tend to improve. It's not always a cure-all, but if you can see improvement in some of these chronic diseases and people, feeling better and be able to have better quality of life,
Mm-hmm.
that's a landmark.
Yes. Yeah. So I'm always curious as to how someone comes up with the title of their book. Like your book says Beyond Digestion is like the main title. Can you tell us like how you thought of that title and what led to kind of ultimately deciding on the title of your book?
Well, when we take things on that are more than we can digest at any one time, and I talk about that, and our gut is our primary sensing organ. So we are sensing things energetically or environmentally. So energetically through emotions and stress and things like that, and environmentally through our food, right? We taking it in, our gastrointestinal tube starts at our mouth, ends at our bum, and that's kind of our skin on the inside. So we're taking that in, but we have to process both emotional chemicals, and we have to process drug chemicals and food chemicals and things like that. And we know from the research that when we take on more than we can digest in any one period of time, like in times of grief or abuse or trauma or negative life events, we see an increase in irritable bowel syndrome. We see an increase in other types of chronic diseases. What's going on? So there's all of that science stuff. And then there's the side of me knowing that sometimes things are just beyond my digestion, right? It'd be a turn. This is just beyond digestion. I can't do it, right? Whether it's emotionally or whether that's food wise. And this book is about both, right? It's about how we're knit together. It's that physical, emotional, cognitive, and spiritual aspects, and how we're knit together. And sometimes things are just beyond our digestion, and that's what this is about.
Yeah, I like that. And I like that you point out in your book there was like a workshop that you were attending, and the practitioner asked you, how are you digesting the universe? I love that term. I think it says so much.
Yeah, issues letting go. Yeah, for sure. And we were doing some hands-on training, and she had her hands, and it was right on my gut, where the top of my stomach kind of comes in, and she's like, Laura, how are you digesting life? And the first time I was at the course, I just like, oh, that's nice, Verna, thank you.
Yeah.
I'm not sure, I'll have to think on that, but I know there's something there, those shadows lurking. And then the second time I went back, we were doing more training, and this time was like head and neck stuff, and she's zeroing right in on my gut. Laura, how are you digesting life? And I just like, oh baby, this is coming at me.
Yeah. Yeah. It's one of those things. It's such a question, and there's so many layers to it. So I really like how your book doesn't just go through kind of like the kind of the pure gastroenterology anatomical approach to digestion and absorption. You tie in these other aspects that you're talking about, such as emotional health and well-being, and how the brain and the gut interact with each other. So it's good. It's a difficult task to represent gut health in the right way, because it's very complex. It's not just this tube that runs through our body.
No, like you're so right. And there's lots of books out there that talk about, what food to eat, talk about, how, the anatomical, how we digest food, that tube that runs through. And then there's the gut health, the gut brain axis. There's lots of information on that. And then there's lots of books on the microbiome, and they talk just about the microbiome. But what infinitely intrigues me is how we're knit together. What knits us together?
Yeah.
And And I think the gut has a lot of answers.
Yeah, absolutely. Yeah, so let's go into a little bit of this. You know, there's a couple things that you point out in the book that you do for testing. And I just want to hear a little bit more about your thought process. I mean, when I'm thinking about evaluating the gut, there's just so many different ways you can go about it, and you really mentioned 3 or so tests that you like to look at. And could you just comment on those tests and why you feel that those are preferable?
Yeah, for sure. I mean, I always say there's many ways to climb the mountain, and always looking for the window in which makes best sense for the patient, both clinically, but also for us up here, budget wise, because we're paying for a lot of these things out of our
Mm-hmm.
pocket. So it's finding what makes best sense. And the top three tests are, the food sensitivity test, which is by no means perfect, but it gives us a helpful place to start. Um, and then the comprehensive stool analysis with the parasitology, looking at both the PCR and the micro culture, looking at things under the microscope. So that one, and then the gluten testing, because 7 out of 10 people are, if your test will have some type of gluten sensitivity, not necessarily celiac, but the non-celiac sensitivity. So
Yeah.
those are the top three that I like to present and discuss the options with the patient. We, I've, as a practitioner, as you know, we love to have all the data you can.
Mm-hmm.
Not always feasible. Great when it is, because it gives you a more complete picture. But you also still have that patient sitting in front of you, and they live in their body 24/7. And the more that you can connect with the patient themselves and understand what it's like to be them in their day-to-day life and what's limiting them, you start to get a sense for what the obstacles are, and the testing often is confirming it.
Yeah. Okay. And you use the Cyrex test, I think, for gluten, right? Um,
I use the Cyrix Array 3X test. Yes, that's the one that we're able to get in Ontario.
mhm.
Um, just because of provincial regulations, sometimes we're limited to other good tests that might be available, but that's the one I tend to use in practice.
Okay. Yeah, it's I think a lot of people don't realize, and you point this out in your book, is that there's that the transglutaminase antibodies can, which is the antibody that's detected in celiac disease, that there's actually various tissues that can specifically target. You talk about that a little bit in your book, such as how that particular test can isolate whether the autoimmune attack is on brain tissue or gut tissue or both. Can you just comment a little bit about that? I thought that's a fascinating test that is not generally available.
Yeah, I really like it because I mean, when typically in our provincial testing, if a conventional doctor were to send somebody, they're going to test on the tissue transglutaminase 2, right, which is typical for the gut villi, which you would see, and it would help lead people to further testing potentially if they saw something going on there for celiac disease, right?
Mm-hmm.
But as we're learning, the damage that gluten does isn't just in the villi necessarily. Sometimes the damage can be done through the skin. And the reason why is because there can be a cross contamination with the actomyosin layer within the gastrointestinal tract, which is part of the skin.
Mm-hmm.
I mean, we have a skin on our hands and our feet and everything, but we also have skin skin within, right? And it's really thin. So, hey, that rhymes. That's pretty good. So anyway, so the actomyosin layer is something that you can get that cross reaction and have with that autoimmune reaction within the rest of the body. So now you have that same layer around your liver, around your, different organs. You have that in the other parts of your connective tissue and the other parts of your skin. So you may have a gluten autoimmune reaction happening within the skin. So there's that side of it. And then, the type 6, the tissue transglutaminase 6, that one is essentially the nervous system in the brain. And we see that with the cerebellar ataxia, that people having difficulties walking. sometimes in the nervous system with multiple sclerosis, that type of thing. And the research may not be definitive, but it's strongly building.
Yeah. Yeah. I mean, I think it's so many people come in with brain complaints, right? Like brain fog, memory issues, focus issues, and they'll go through lots of evaluation and workup through neurologists or psychiatrists and what have you, and sometimes left without answers. And I think it's really important to kind of check that box to see if the cross reaction with gluten is actually happening on brain tissue. I mean,
Yeah.
we learned about the the extraintestinal symptoms of celiac disease in medical school, right? But it often just kind of gets thought about as being purely as a gut reaction. So I'm really glad that you pointed that out, because I think that's a growing area of, like you said, research for gluten related disorders.
Mm-hmm. Yep. Sometimes there is no tummy ache.
Right. Yeah. Yeah. Um, so, so that's, the food sensitivity testing. Now that's always been kind of a bane of my existence. And I think also for patients,
Yeah.
I think it's always something that I wish it was more solid. What do you see happening with food sensitivity testing?
Well, it's interesting because I'll do blood work and a couple of different types of blood work. Um, and I will do electrodermal screening in the clinic. Um, and I find food sensitivity testing is, 80 to 90% accurate.
Mm.
But if somebody's quiet enough in their own body, they often already know.
Hmm.
Okay. Like if I'm running testing, they'll be like, yeah, well, I never eat that. And I'm like, and why? Like, what's the reason why you don't eat that? Right? Because the body already knows. So I use it as a guided elimination tool, right? And if something doesn't make sense on the test, then we work with that clinically. But it is a guided elimination tool. And
Yeah.
I have found it is helpful because it does pick up on quite a bit. The LCAT test is one that they'll take the food antigen and they'll introduce it to the white blood cell one at a time, and then they'll be able to see how does your immune system actually react to it. So that one can be quite interesting. Um, and then there are some blood tests that are run. I don't often use the IgG testing. I find those are, um, I don't know, I don't find them as helpful to work with.
Hmm.
Okay. I would do the electrodermal screening in the clinic as something cheap and cheerful. And you know, it does give us, it's not clinic. I always say it's not clinically diagnostic. It doesn't diagnose or treat anything, but it's a really great start. And actually working with it can be pretty helpful. And I'll run mine on myself once or
Hmm.
twice a year. And yeah, I mean, except for maybe one thing on there, it's pretty accurate. Like I'm like,
Yeah.
yeah. Mm-hmm. So yeah,
Yeah.
it's one of those things. I can see why it's kind of a bane of your existence because they're not entirely accurate. They're difficult to interpret.
Yeah.
So that's where they have a place and a purpose, and that's how I use them. Keeping in mind that they are not perfect, but sometimes they can reveal things that are very helpful to people.
Yeah. Yeah. I've also been moving towards more of the LCAT testing, just because, um, from from a standpoint, like a biochemical standpoint, what they're testing makes a lot of sense to me.
Mm-hmm. Yeah.
As far as like uh, mediators of inflammation. So it's interesting just to hear other people talk about it, and I resonate with what you're saying. So when people have food sensitivities, like oftentimes we'll get these reports back, or they'll go through food sensitive testing, and there's there's a lot of information that comes back as far as potentially reactive foods. How do you help people cope with food sensitivities, just in your practice?
Well, first of all, if somebody's coming back with multiple things coming up, typically that means they've got a leaky gut.
Hmm.
right? Like the system is responding to things that are breaching the gastrointestinal barrier that really should be kept in that food bolus going down through the tract.
Mm-hmm.
So it's elimination diet that suits them for the time being. And I usually say you would avoid, the things that come up stronger. You're avoiding those for 1 to 3 months, depending on how long they've had the condition.
Mm-hmm.
And then we would work on healing the gut barrier. We would work on the dysbiosis that's likely in the gut, causing that, because typically it's an overgrowth of some type of gram-negative bacteria or a parasite or some yeast. So we're looking at, cleaning that up, healing the gut lining, eliminating those foods, and then after a period of time, reintroducing one at a time. So I would say, say we've got food A, and see people sometimes ask, okay, what order do I reintroduce? And I'll say, well, it's either if there's something you're really missing, let's reintroduce that first. But if that's the something that you're suspecting is what's really bothering you, then maybe we leave it to the end.
Mm-hmm.
So sometimes it's more of those benign things that would be typically benign.
Yeah.
Because in a leaky gut, typically we're looking at, gluten, dairy, sugar, kind of top offenders. If we have, joint pain, arthritis, then we're looking maybe at the nightshades. Okay. So kind of looking at those sometimes, but sometimes, it could be lectins, or it could be FODMAPs. It could be other types of things that can go all over the map, right? Like really, it can be quite crazy, and people can get a little bit nutso with it all. Really, there's a nice medical term there, but it can happen. So it's trying to be realistic, because we know that a varied diet is the best diet, because variety is important. But it's introducing those foods one at a time. So I would say, so if you had food A, so say we're reintroducing, an avocado, so that we would have avocado 3 times a day for 3 days. If we had an issue, then we would stop immediately. We would record it. We'd stay off avocados for another maybe month before we try them again. We would give the gastrointestinal tract the time to heal, which is 3 to 5 days. It will turn over before we reintroduce another food. So then we would go food B, and then give it a try and see how we do. Now, say you ate the avocado and there was no issue. You were okay. Maybe you just needed a break from it.
Mm-hmm.
Because I see that too. And I'll tell you about that in a second. But so if we reintroduce the avocado and you eat it, 2 or 3 times a day for a few days, and I don't notice any difference. Great. Keep eating the avocado. Introduce the next food, and away you go. A cute little story. I had a teacher in once, and she bananas came up really high, and I'm like, "What's with the bananas? I mean, do you eat bananas?" And she goes, "Yeah, I love bananas. I eat them every day." And I'm like, "How many do you eat every day?" And she goes, "Oh, about 3 of them."
Yeah.
And I said, "Well, how long have you been eating 3 bananas a day?" And she said, "Well, since I started teaching, about 40 years." And I said, "Well, they're coming up a little high, and maybe we just need to back off the bananas." Right. So she just needed to take a break from them. It was just too much. Sometimes we lack that variety. We get into a habit, and we've got something that's really convenient that works for us and great. But sometimes we overdo it, and we just need to have a little break from them, and then we're okay.
Yeah. Yeah. So it seems like you help people with that structure of like navigating this world of food sensitivities. I mean, it's probably helpful that you've held yourself, you've gone through that kind of struggle yourself, right? I think you even mentioned it in the book, where it's like you just decided one day to just accept and go forward with the issues you were having related to food. Maybe you were talking about like a trip you were with your husband, and I can't remember exactly the line, but it caught my attention.
Yeah, there's been a couple trips. There was, the first time when I was trying to figure out what was going on, I had a lot of eczema and rashes around my ears and my face, and lots of stuff going on. And so I had eliminated all the gluten and thought oats were fine. So I'd taken, was that the story you're remembering?
Yes. Yeah.
I had taken the steel cut oats with me, because I thought, because we had like a little kitchen we could do breakfast in, and that was pretty handy. So, well, this will be good. I'll make some up and I'll have them for the week. It'll be super easy. And then, get there, and I've got my little Ziploc with my steel cut oats. I'm pulling out of the suitcase and putting it on the counter. And My husband's looking at me and he's going, I think that's causing your rashes.
Hmm.
And I'm like, oh. And I knew like oats is a cousin of wheat, and I'm thinking, good, I'm still good with it because I love oats. And I'm like, oh geez, what if he's right? And I'm like, okay, what have I got to lose? So I just opened up the trash can, put the oats in, and I'm
Yeah.
like, I got to literally do this because else I'd probably cook them. Um,
Yeah.
and and I said, okay, let's try it. And about 3 weeks later, my skin was clear because
Yeah.
I totally was off it. And I tease in the book, yeah, because so was my humility. Because my husband's diet isn't always
Right.
my poster child. I say, I mean, he tries really hard and he does his best. But at the time, I'm going, oh man, what if he's right about my diet? How could that be? So, anyways,
Yeah, yeah. So
yeah,
he needs to get an honorary ND degree
yeah. There you go.
for
He'd like that
sleuthing that out. So,
for sure.
well, that's that. Yeah, I think the interesting thing about that process is like when people do identify that they have a food intolerance and it actually pans out, then it's all worth it, right? It's the not knowing of the process that makes it so difficult. Like, is this going to be something that I'm reactive to based on the data I have so far? And I think that's the most difficult part. But if you do find a food sensitivity that you identify and it clearly improves your life and well-being, it's so worth it.
Yeah, and I find that sometimes after doing that elimination, and then you reintroduce, and maybe it's going well, and then maybe you start getting that skin rash or whatever, a month or so down the road. I'm like, okay, well, maybe it's not an all or nothing, right? Maybe it's a percentage. Maybe you can have this 15% of the time,
Yeah.
but maybe 85% of the time you should stay away from it. So then it's like food rotation or that
Hmm.
type of thing. Like
Yeah.
some people can handle certain foods and be okay with small amounts. We know most people lose their lactase enzyme to digest lactose in milk as we age, right? So some people, it's okay to have a little bit of cream in their coffee, but if they were to have a glass of milk, that'd be a no-go,
Right.
right? So it's sometimes quantity too.
Yeah, that's kind of where I'm going after being doing this for some time, is that working on finding modifications within those those food intolerances, such as like, well, maybe try a different brand, or that's made in a different facility, various other attempts to try to incorporate food intolerances that, so that people people have exhausted their options within that food intolerance. So yeah, I think it's good to have modifications like you're mentioning.
Mm.
So there's a couple of nice things you bring up. I want everybody to go out and get your book, so I'm not wanting you to spill the beans, but the I'd love to hear just about one of the healing foods that you mentioned that um, I really liked hearing was like the baked apples. So those that was an interesting kind of recipe you put in the book. Can you talk about why you like baked apples and what they might do for the gut?
Yeah, I love baked apples too. Uh, Especially, you got to leave the skin on. That's the whole idea. And I mean, preferably organic, right? If you can, but if you can't, make sure you wash the outside with some vinegar and water, or lemon juice and water to try to break down the pesticides, because apples are heavily sprayed. If they're, even organic ones could have an off spray or something, so still wash them, obviously, but leave the skin on. And then as you're baking them, and you can put them in the oven, you could also just chop them and put them in a pot too, because it's the heat that releases between the skin and the fruit. There's the pectin that's released with the heat. And that pectin is very helpful for healing the gut lining. So it's pretty simple. We always said an apple a day keeps the doctor away. So this time it's cooked, right? So it makes a
Right.
difference. Yeah.
Yeah.
So the release of that pectin, and that pectin in the layers of the gut can be quite helpful for healing the lining.
Hmm.
And people tend to love it. Um, they love that prescription and they'll do it. And I mean, as you know, if you can talk about all these great things in the naturopathic world, but if people aren't willing to do it, like I always say, just be honest. If that's not working for you, we'll find something else. But
Yeah.
so yeah, most people like the apples. Yeah.
Yeah, sprinkle some cinnamon on it. That's a nice antimicrobial, like a gentle antimicrobial biofilm eradicator. Yeah, it's really fun when you find foods that heal the gut. I mean, I think that's just fascinating. Even things like ghee, and um, chia seeds, and it's just fascinating when you really dive into what's out there as far as gut protective and gut healing foods.
Absolutely.
Um,
Food is really our medicine, right?
hmm hmm So, well, the uh, the other thing that really jumped out when I was kind of reading your book and um, just looking into your background, something of personal interest to me is, the use of biofeedback and heart rate variability. You've gone to some pretty in-depth training, like with heart math, and I've always been fascinated about connecting heart math with the gut, and or just how you use heart math, which is basically a system of mindfulness and heart rate variability training and meditation. It's kind of all in one, right? Um, how do you use that in your practice when it relates to gut health?
Pretty simply put, like stress management, because we
Okay.
know stress affects the gut. We know that heart, like our heart, each beat to beat variation of the heart has a signature emotion. And we can actually regulate our physiology by regulating the, the heart rate variability or the beat to beat variation. And we can do that with our breath and with focused intention.
Mm-hmm.
And this is what the heart math program teaches, is that that ability to address that and to affect that. When I'm using it in practice, I mean, you have to think everything is energy, right? Everything has a vibration. And if we are looking at the heart rate variability when we're frustrated, it's really jaggedy.
Mm-hmm.
Okay. It looks like you're on edge, literally,
Mm-hmm.
right? And when we're really apathetic or in grief, it's really low, right?
Mm-hmm.
It's a low vibration. And then we know that when we're in the flow, in that creative flow, in that place of love, care, or gratitude, it's very much of a sine wave. It's really smooth, right? Really smooth. And that is the area that we are healthiest, is when we're
Mm-hmm.
in that nice smooth sine wave. So if we can affect, you know, the heart rhythm to be there, how is that now affecting the rest of the body? And we are electromagnetic beings, and that's going to affect. And the gut also is affected by vibration,
Mm-hmm.
right? Um, there's some studies, not a lot, not as many as I'd like, but it's affected by vibration. So attuning to a smoother vibration is affecting our physiology, down regulating all of the stress hormones, right? So we have less cortisol running around. Cortisol is brutal on the gut if it's not within our proper rhythm, right? We have
Mm-hmm.
a natural cortisol rhythm, which is pretty healthy, but when we're pumping out a bunch of it, it's not so nice. And as I talked about at the beginning, um, when we take on more than we can digest, when we have times of intense emotions, it's really our ability to emotionally regulate and how we respond to the stress that makes the difference. So the heart math program allows me to help people become more um, emotionally intelligent and be able to emotionally regulate, so that you're managing your stress so that um, it doesn't have such an impact on the gut. And
Mm-hmm.
that's why I went. And I mean, of course, as a practitioner, it's like, I'm not going to a course. I'm going to learn how to do it so I can teach everyone else.
Mm-hmm.
And people come back years later and say, you know what, I still do that heart math stuff. I love it. Thank you. And you don't, they sell and I do the biofeedback so you can actually see, because people want to know, am I doing it right?
Yeah.
But what the most important thing is not what the computer is saying. I mean, that's helpful because it's confirmatory and affirmatory, but what's best is what people are feeling in their body. It's like, okay, now what are you feeling in your body? And it's teaching them those subtle things, right?
Yeah.
And I talk about, listening to your body, listening to it when it shouts, yes, but also listening to when it whispers to it.
Mm-hmm.
Those are the finer things. So it's people tuning in.
Mm-hmm.
So helping them understand that connection bridges the gap between their experience in their body and what science is saying, and kind of bringing that together.
Yeah. Yeah. It's interesting. I always you hear when patients come back from a vacation or what have you, is my gut was, after a few days, my gut was perfect on vacation, right? And I always ask them, like, how was the vacation? Like, who were you with? What what was your mood like? Oh, it was amazing. And then they list the number of things that they did and the great time they had. And the heart math reminds me of like training yourself to feel like you're on vacation, even during times when you're not.
That's so true. I mean, I always say it's like a little mini mental vacation, and it's teaching people to engage in that experience, to re-experience, and I'll often take them back to their favorite vacation.
Oh,
Um,
okay. Yeah.
yeah, yeah, and help them engage their five senses while they're in that experience, taking them back to be in that present moment now. Yeah.
Yeah, it's fascinating because so much of the digestive experience begins, you know, with things that have nothing to do with the actual first bite. It's like seeing, smelling, um, what kind of state of mind you're in. It trickles downstream, as they say. So it's I think it's such an overlooked part of this, and I've often wondered if there would be a way of um, having people do heart math when they're reintroducing foods, that they've been sensitive to, and see if they have increased tolerance if they do some type of mindfulness work uh, before they do like a challenge. Do you ever do anything like that? I once brought it up to someone, a close colleague of me, and she laughed like it was ridiculous. But I, I still, like, that was like 8 years ago. I still think it would be a really interesting experiment to have people do mindfulness work before they're, if they're having some food aversions, or if they're having troubles with food intolerances, and then reintroducing.
I think it's a fabulous idea. Maybe a study to figure that out.
Yeah, in
But
all our spare time,
all
right?
our spare time, and yeah, yeah, exactly. But the concept is there because if your gut is happy, and you have to think all those microbes, right? These, we have 10 times the amount of microbe cells than we do human cells, and 99% of the genes we carry around are these bugs in our gut. And I mean, we better keep them happy, right?
Mm-hmm.
And if they're happy, we're going to be happy because they're really sustaining us. And if they like these calm waves, and this this experience where we're creating that nice sine wave within our heart, and a nice calm environment, you have to think that's going to be helpful to them. But you also think of the nervous system, right? The vagus nerve, lots of talk about that. And if we're always in fight or flight, we're not in rest and digest. And we know there's other components and stages within the vagal nerve stage, but those are the two main ones people often think of.
Mm-hmm.
But if we are in the in that flow, or in that place of gratitude, or feeling like we're on vacation, in that spot where we have that nice energy, obviously the vagal nerve is going to be sitting in a place where we're feeling safe and protected, and we're able to be calm, and that's what we need in order to digest, right?
Yeah, even just to release hydrochloric acid, right? It's You have to be more parasympathetic dominant to be able to get into that state. So yeah, it's fascinating, and I think one of the nice things about your approach is that you tie that in together with some of the more kind of classical approaches to gut healing. So I think people will be drawn to to what you do, because you're also incorporating the mind body components.
I think it's important, and I'm intimately fascinated with, it was kind of the last layer. I talk about peeling the onion, but the last layer is the spiritual layer, like your soul. Like, what the heck does your digestion have to do with your soul, right? But it's understanding that whole yin and yang. And we've been in this, Western society, just go, 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 just, which is very yang, very outward, very movement oriented, right? And we know with every big yang, we need a strong yin to balance that out. And it's in the yin when we digest. And if we've always been in this go, 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 are we really digesting not only our food, but are we digesting the world around us? You have to think go, go, go. You have no time for other people. You're only thinking about what you have to do next. You're not, less compassion, less gratitude, because you're just, you're task oriented, very left brain, logical. That's the driver. That's, the yang side. But then the yin side is our right brain, and this is what's connecting, and this is where the information's coming up from our gut up into our brain. And we also think of the right side as our creative side, and creativity is connected to the greater being, right?
Mm-hmm.
And this would be the connection into the soul. And we always, I'm always thinking, the you always think, it's the soul is in the heart, but I think the soul's also, in the gut.
Mm-hmm.
And and I go down esoteric paths on things there that would be far way out, but I find it intimately fascinating, and I think
Yeah.
it'll be a while before science catches up.
Yeah. It's funny because my rabbi once he asked me what, I was telling him I was running off to give a talk on gut health. And he said, gut. He said, do you know what gut means in Yiddish, which is a kind of a language that developed in Eastern Europe amongst Jews. And he said, gut means God.
Well, I love it. That's great. I wish I'd known that. I would have wrote it.
Yeah, but it's pronounced gut. But yeah, so anyways, it's fascinating. I always think about that, that there is that spirit connection.
Well, you think, the solar plexus. Some people who look at, in the Ayurvedic, they're looking at the solar plexus, which is a lot of how we interrelate with the world.
Mm-hmm.
And this is a big, area of soul connection too.
Mm-hmm.
Right? Yeah. So we're all tied together. Yeah.
Yep. So I read a lot of materials from this famous scientist, Richard Feynman, and one of the things that he mentioned this week, and I wanted to ask you this question because he's no longer with us, but he stated that when he would talk to people that really are specialists in what they do and have really dove deep and written books like you have, he ultimately finds that they're in a place of awe, like, because you get to a place where you realize there's certain things that still puzzle you about this topic, and like unknown pieces that you're still trying to figure out when you kind of become an expert in areas. And you kind of start your career with feeling like, oh, I've got this, I'm really good at, I'm really confident, and I can help so many people. And then as the years go, you get into these complexities and these really complex cases, and you kind of reach a point where you're like in awe because it's not as easy as it seemed. So does that resonate with you at all?
Absolutely. I mean, if I always find the more you learn, you don't know.
Right. Right.
Right.
And that's another way of saying it. But I'm just curious, like what are you up against? What are the edges of this frontier of gut health that still kind of are researching, are really eager to learn, and there's still some kind of puzzles that you're kind of figuring out. What are your current puzzles?
Gluten and chronic disease. So doing
Hmm.
more research into that, and I was, I did an article for Naturopathic Currents. It's published now. You can look at it, and it was quite strong, and even caught me off guard. It's like, it can't be everything that's causing our issue, but it's causing issues, and we're able to point our finger at it in a lot of ways. And then I'm like, well, what happens if, we're really, none of us really can digest gluten. It just, most people will repair from it before they eat it again. But for those who are susceptible, they don't ever repair.
Mm-hmm.
And so it's like, wow, that's a big proponent. But how are we going to substantiate from a agri-food industry to provide people with nutritious, easy, affordable food if we all go gluten free? What happens, right?
Mm-hmm.
So that's an interesting one. And then I was doing some research on Saccharomyces boulardii, which is a
Mm-hmm.
non-commensal yeast. And, I've used it a lot. I even write about it in the book as one of the things that I go to. And, you know, I thought, oh, great, it helps us make IgA, helps reconstitute our,
Right.
our immune defense in our gut. This is good. I'll use that, right? And then so I, I was doing another article, and I was floored at all the new stuff that I learned. I had heard about some stuff, so I thought, oh, let's dig into it. Um, so lots of infection control, microbiome balance, intestinal border health. It
Mm-hmm.
actually can bind to um, organisms and prevent them from infecting us. It works with our immune system. Yeah, it's pretty cool.
Yeah, I love Saccharomyces boulardii. It's low cost too. I mean, it's that I think it can get into a lot of people's hands that need it. So
Mm-hmm.
it's really great that it's out there. And yeah, yeah. There's just so much. I mean, when you open up the microbiome channel, it's there's years and years and years of learning ahead of us. So it's
It's really detailed, and sometimes the more you dig into the detail, like it's great to have that level of clarity. But sometimes I find you have to pull the like take the camera lens out a little bit again
right,
and look at things holistically, right? Because that's
right.
our role as naturopathic doctors, right? Is to look at things holistically. Do your deep dive, but then come back out and
Hmm.
look at what are we dealing with as a whole.
Yeah.
Because we know that what is micro is macro. What's going on in us is also going on in our environment outside. Our gut is like a garden, right? And if you're looking at what's going on in the environment outside, externally, losing, varieties of fruits and vegetables, um, losing, our health of our environment. This is also being reflected within us,
Hmm.
and we are a reflection. When you think of the toxins, think of the plastics that are in our diet, like, I mean, in our food, right? Plastics, breaking down in the water, the fish are eating it, we're eating the fish, or, it's getting into the streams and the cows are drinking it, it's getting in the milk, that type of thing. I haven't done a study on the cow milk, so don't quote me on that, but I know the fish for sure. But they even found that there's like plastic in people's poop.
Yeah.
So it's sometimes, yeah, looking at the real nitty gritty details in the microbiome channels, but then also coming up out and looking at the world. What are we doing?
Yeah. Yeah. Interesting. Yeah. And I really like that in your book, how you take people through like a personal assessment of exposures, environmental exposures. And it's really important to think of, especially since the gut liver axis is so relevant. It's, um, you know, the gut and the liver communicating, and that process often is overlooked. You think about like the Western paradigm of treating gut issues. It's like, well, take this pill to suppress your acid, or take this, immune modulator to stop the inflammation. Nobody's thinking about like what's going down upstream, what's going on upstream or downstream. Like, well, the the liver is needing to process these drugs. The liver is also processing microbiome metabolites. So it's just really great that you're, with your training and your functional medicine training, that you're able to kind of say, yeah, back out, like look at the big picture, of what's going on here. I think that's just, in general, the role of a clinician, right, is to make all this information applicable and useful and actionable, right?
Otherwise, it's just information, right?
Yeah, and we're kind of yeah, just kind of talking academically, but the patient's suffering, they need help now, right?
Yeah, yeah, and it has to be something that they can grasp hold on. And I always say, it's about progress, not perfection, or evolution, not revolution. Just pick somewhere and go. I was chatting with somebody else on the author podcast with the publishing company, and it was so funny. We talk about the book and everything, and he's like, "What's one thing that you want everybody to know?" And I just come out with, just eat more vegetables. And I thought, oh, how lame is that? Like, but it's so true. Like, and I probably picked up on that because maybe this guy needed to eat more vegetables. That might have been right. But it's so true. Like, if you can just pick one thing, sometimes that small thing makes a big difference, and
Yeah.
that might be vegetables. So I love vegetables, and I always say, pro vegetable, not pro vegan, but pro vegetable.
Yeah.
And if you can eat more of them, that's gonna be good.
Yeah. Yeah. So eat a bunch of vegetables slowly with and chew them,
And chew
right?
them and
Yeah.
enjoy them,
Yes.
and
Um,
think lovely thoughts, be in good company. Yeah.
yeah. Well, on that note, I'm not going to ask you to tell us to eat all more vegetables because you just did. So, I would love to just kind of hear some just take home messages. And then if you could just tell us about your book, where to purchase it, and any like things that you're up to professionally and how people can follow you and get into contact with you.
Certainly, yeah. So, take home points is that your gut health, if you can influence your gut health, you have a ton of influence on the rest of your health. So, taking care of it is a really good place to start.
Mm-hmm.
So that's a key. And there's many different ways you can do that, as we had talked about. Healing the gut lining, getting the microbiome in balance. You know, helping support our detoxification. Our body's always detoxifying. Um, and listening to the body. Listening to when it screams, but also listening to when it whispers. So understanding that and getting more in tune with what's going on. Testing can be important, but it's not the be all and end all. You live in your body 24/7. Um, Record what you're experiencing. Sometimes even just recording what you're eating and when you're eating and how you're feeling is a remarkable journey for some. So
Mm-hmm.
there's many different ways to climb the mountain. It doesn't have to be big stuff. It can sometimes just be very small and can make a big difference. Um, Talk about that. Lots of stuff. Obviously, gut health connects to your mind, body, and soul. That's what the book looks like. Um, the I like the image that we did on here.
Yeah.
People have told me, it looks like the gut. It looks like the soul. Like the enigma for the soul. It looks, the colors look like you threw up. It makes me think of the microbiome. So, I mean, it's like, what do you think that has to do with it? But it was just, the sketch came to me one day. I was like, this is what needs to be on it.
Yeah.
And then the publishing company did a great job with the artwork. So
Yeah.
really appreciative for that. It's live on Amazon. Yesterday, it went up on Amazon. And for the first week, as a book launch promo, the ebook is 99 cents for until next Tuesday.
Okay.
So if you have Kindle app or Kindle, you can download it for 99 cents
Mm-hmm.
and have your read through. A lot of people have said that they've done that, but they've also ordered the paperback because it is a type of book that you want to underline and refer back to.
Mm-hmm.
So that's sometimes an option as well. So Amazon is a great place to order it, and that's worldwide. So Amazon.ca, .com,
Mm-hmm.
.uk, Australia. It should be everywhere. Um, and then I do a lot of, as you and I had met on LinkedIn, just
Mm-hmm.
business stuff, posting information. If I find an interesting article, I might throw it up there with a few comments as to why I thought it was interesting.
Mm-hmm.
Um, my Instagram is more like my nature walk. So if you want to go for a walk with me in the garden or on
Yeah.
the trail, that's usually that's what it is. This week's it's pictures of the book, but usually it's more that helping people rest and digest if they want to. This is where I go to have fun and
Mm-hmm.
just unplug is out in nature. So it's sharing that with people so they can look through it. And then My website. I do a lot of blogs on the website, and if I've done articles or podcasts like this, I'll often take the recording and post on the website. So
Yeah.
it's a nice hub
Yeah.
to go into to peruse around into different things. And
Hmm.
I would say 90% of the pictures on there I've taken myself. Some of the family members have taken and let me share. So I'm sharing some of my travels or my queer eye for things.
Nice.
My mom is the greatest photographer, and
Oh, okay.
I never was very good. So this is kind of my my growing ground to
So that's how you
yeah.
became Miss Ontario, huh?
Yeah. Oh, that was fitness. That was
Oh,
back in the 80s when, fitness competitions were really like fitness competitions.
so it was
And
based on
yeah,
really being at a high level of fitness. Wow, that's cool.
so
And mom was taking pictures.
yeah, yeah, always. uh,
Well,
always.
well, good. Well, yeah. Anything else, or you're doing like book tours, or just kind of like talks now? Now that you have the book launch.
Yeah, I'm really super excited about any kind of podcasts or things like that to engage with people so
Hmm.
that we can just chat up the subject and help people become more aware of how the gut's connected to
Yeah.
anxiety and depression and chronic disease. Just create awareness around the subject because I think it's really important. We're given one body in one lifetime, and there's lots we can do to take care of it. And I'm trying to do my part to contribute how I've learned. That's all I can do. And
Excellent.
so I'm just, yeah, I welcome that. And I mean, hey, this is fun. I get to meet you. So
Yeah.
this
Yeah.
is good. I'd love to be doing this, more often.
Great.
Yeah.
Well, thank you so much for spending the time with us, and congratulations again. I think I've enjoyed reading your book, and I think a lot of people will learn a lot from it. So I wish you much success.
Thank you so much. I look forward to connecting again.
Yes, thank you.
All right. Take care.
Take care.
Okay.